The e-cigarettes, including vape, pens, e-liquids and flavors such as sheesha, are said to have increased in consumption and popularity, exposing youth and minor children to health harm and moral decadence. According to the lawmakers, the e-cigarettes are classified as non-tobacco, hence lacking restrictions on use and promotion. Our reporter Kamcha Menza has details of the events that transpired in Parliament.
Kenyans who consume e-cigarettes, including vape pens, e-liquids and flavors, those who sell and those who promote, may face restrictions if a motion in Parliament seeking its regulation in use, sale and advertising is put into a bill, adopted and becomes law.
Matters relating to e-cigarettes are now fashionable, particularly for younger children. Mr. Speaker, there are a number of schools, at least I know a few in Nairobi, that have had to actually issue circulars to parents to warn them about their children bringing to school or engaging in vaping and the partaking of e-cigarettes.
I think in the new bill, and I want to encourage Senator Muma, that we must regulate it properly. We must have a way of penalizing anybody who is found with those drugs, under 18 in particular in schools.
Nominated Senator Catherine Muma, who moved the motion, says there is no restricted promotion on social media as well as used by adults, consequently attracting youth and minor children who increasingly engage in it.
Like the clubs whereby this is what is so much trending. Like if you do not know how to use this gadget, then you're not a millennial, you're not up to the 2023 status and lifestyle.
Research around the world has shown that the e-cigarettes actually cause a lot of health harm.
Senators want the Ministry of Health and the Tobacco Control Board to establish rules to govern the production, sale and use and control the illicit trade of counterfeit products.
When the Tobacco Act was being enacted, the issue of e-cigarettes, access to e-cigarettes, was perhaps limited to a very, very small, actually an insignificant percentage of our population.
These cigarettes are all over, available in many of the outlets. So, Mr. Speaker, this motion is very timely because as a country, we need to respond to a crisis.
The final dangerous active reagent is nicotine. What do we do to make sure that nicotine does not affect children or people who are not willing to be affected or secondary smokers? I do support.
Meanwhile, Labour and Social Protection Cabinet Secretary Florence Bore says the government will soon sign bilateral labour agreements with 5 countries and possible get job orders before end of year as government moves to address the high unemployment threats.
We are in the process of processing the bilateral labour agreements for 15 countries. But the ones that are at advanced stage is Oman, Kuwait, Saudi Arabia, United Arab Emirates, Austria and Germany. And within this year, we should be able to get job orders from those countries.
Kamcha Menza for Prime Edition.